You're 28. It's a weekend in early summer and you've just come back from a long hike. Later, showering, you find it on your calf. A tiny black dot, no bigger than a poppy seed. You pull the tick off with a pair of tweezers, flick it into the toilet, and think nothing of it. 3 weeks pass. You wake up feeling like you have the flu, a low fever, aching muscles, a headache that lives behind your eyes. You chalk it up to stress. Then you see it. On your thigh, a perfect, circular red rash, warm to the touch. It doesn't itch. It doesn't hurt. It just sits there, an alien signpost on your own skin. You Google bullseye rash. The first result is Lyme disease. A cold knot of dread tightens in your stomach, a premonition that your life is about to divide into 2 distinct parts, before the tick and after. The flu-like symptoms don't fade. They deepen. The fatigue is the worst part, a heavy, leaden exhaustion that settles in your bones. It's not sleepiness. It's a total system failure. Showering feels like running a marathon. The pain starts too. It's a migrating, ghost-like ache. One day it's a sharp stab in your left knee, the next a dull throb in your right shoulder. The bacteria, Borrelia burgdorferi, are no longer localized. They are using your bloodstream as a highway, colonizing new territories. The scariest moment comes when you're driving. The right side of your face goes numb, then starts to droop. You pull over, heart hammering against your ribs, convinced you're having a stroke at 28. It's Bell's palsy. Your first terrifying glimpse of the neurological war to come. Your primary care doctor is skeptical. You mention the tick, the rash, the migrating pain. He orders the standard 2-tiered blood test. You wait a week, full of anxious hope for an answer. The phone call is cheerful. "Good news," the nurse says. "Your Lyme test came back negative." It doesn't feel like good news. It feels like a door slamming shut. The doctor suggests it's probably just a persistent virus or maybe anxiety. He offers you an antidepressant. You are now adrift in the diagnostic gap. You don't know that the standard ELISA test can miss up to 60% of acute cases because your body hasn't produced enough antibodies yet. All you know is that the test says you are healthy, while your body screams that you are not. By 29, you are a professional patient. Your life becomes a blur of waiting rooms and sterile exam halls. You see a rheumatologist for the joint pain. He diagnoses you with fibromyalgia. You see a neurologist for the brain fog and facial paralysis. He can't find anything on the MRI. You see a cardiologist for the heart palpitations. He tells you to cut back on caffeine. Each specialist sees a single, isolated symptom. No one connects the dots. You are the only one who holds the whole story. You start carrying a 3-ring binder to appointments, thick with lab results, symptom journals, and printouts from medical websites. It's heavy. It feels like you're doing their job for them, building the case for your own invisible illness. By 30, the infection is entrenched. You now have what they call late disseminated Lyme disease. The arthritis in your knees is so severe some mornings you can't walk. But the physical pain is nothing compared to what's happening to your mind. The brain fog is a thick, suffocating blanket. You lose words mid-sentence. You forget your best friend's name. You walk into a room and stand there, completely blank, unable to remember why you came. You are also becoming hypersensitive to light and sound. The hum of the refrigerator is a roar. Sunlight feels like a physical assault, forcing you to live behind drawn curtains. This is the most terrifying part. It's not just your body that's being stolen. It's your mind, your personality, your very self. You feel like you are disappearing. After 2 years, a new doctor finally agrees to run the more sensitive Western blot test. It comes back positive, indisputable. The relief is so intense you almost collapse. You have a name for your tormentor. You have a diagnosis. An infectious disease specialist, following official IDSA guidelines, prescribes a 28-day course of doxycycline. For the first 2 weeks, you feel a little better. The fog lifts slightly. The pain recedes from a scream to a dull roar. But at the end of 28 days, you are still profoundly sick. The doctor tells you the infection is gone. He says you now have post-treatment Lyme disease syndrome, an autoimmune response. He has nothing more to offer. The system has done its part. You are on your own again. You refuse to accept this as your life. Late-night searches lead you to a new term, Lyme Literate Medical Doctor, or LLMD. You find one 2 hours away. His office is cramped and cluttered, nothing like the sterile clinics you're used to. He spends 90 minutes with you. He listens to your entire story, from the tick bite to the crushing fatigue. He looks at your binder not with annoyance, but with respect. At the end, he looks you in the eye and says the words you've been desperate to hear for years. I believe you. This is real, and we can treat this. For the first time, you are not fighting a doctor. You have an ally. You break down and weep. Hope has a price. The LLMD prescribes a long-term regimen of multiple antibiotics, some administered by IV. The letter from your insurance company arrives a week later. Denied. The treatment is deemed experimental and not medically necessary. You are now in the crossfire of the Lyme wars, the battle between the restrictive IDSA guidelines your insurance follows and the more aggressive ILADS guidelines your new doctor uses. You appeal. You are denied again. Every doctor visit, every blood test, every prescription is now paid for out of pocket. The mean cost for a Lyme patient is $2,227. Yours will be 10 times that in the first 6 months alone. You drain your savings. You borrow from your parents. You are fighting for your health with your credit card. The next 2 years are a brutal grind. Your life is dictated by a spreadsheet of medications, supplements, and herbal protocols. You have pill organizers for morning, noon, and night. The metallic taste of antibiotics is a constant companion. For 6 months, you have a PICC line in your arm, a semi-permanent IV. You learn to sterilize the port, flush the line with saline, and hang your own bags of antibiotics. Every evening, you sit for an hour as the cold fluid drips into your vein, a chillingly intimate ritual. Progress is not linear. You have a good week, followed by a crushing relapse. You are in a constant battle, not just with the bacteria, but with the side effects of the cure. Your social life evaporates. You become the unreliable friend, the master of canceling at the last minute because of a sudden wave of pain or fatigue. After a while, the invitations stop coming. People don't know what to say. They can't see your illness, so they struggle to believe it's real. Some friends drift away. Others say things like, "But you look so good," meaning it as a compliment, but it feels like an erasure of your suffering. You also experience Lyme rage, sudden, uncontrollable flashes of irritability that you aim at the people closest to you, followed by waves of shame. The loneliness is a physical presence, as real as any other symptom. You are a ghost in your own life. You haven't been able to work for over a year. Your savings are gone. Your debt is crippling. You have no choice but to apply for disability. The paperwork is a mountain, hundreds of pages asking you to quantify your pain, to prove your exhaustion. You have to document every failure, every day you couldn't get out of bed, every task you can no longer perform. It's a soul-crushing process of cataloging your own decline. You know the statistics. Over 40% of patients with chronic Lyme have to stop working. But getting disability is notoriously difficult for an illness many still don't fully recognize. You spend months gathering medical records and letters from your doctor only to receive a denial. The reason? Insufficient evidence. You have to start all over again. After years of relentless treatment, something shifts. The bad days become less frequent. The fog begins to thin, revealing moments of startling clarity. The pain is still there, but it's a quiet hum instead of a roar. You are not cured. You are in remission. You have a new baseline for normal, one that is far below your old life, but a world away from your sickest days. A good day is being able to take a 20-minute walk in the park without collapsing afterward. You cherish these moments with a fierce intensity. You feel the warmth of the sun on your skin and feel truly alive, but you live with a quiet fear. Any stress, any common cold can trigger a relapse. You are walking a tightrope, forever changed. You have found a fragile peace. You manage your symptoms, guard your energy, and live within your new limits. But the system that failed you remains unchanged. The guideline war between the IDSA and ILADS rages on. Insurance companies continue to deny care. Every year, an estimated 476,000 more people in the U.S. will be diagnosed, and many will begin the same torturous journey you endured. Out on a trail, somewhere else in the country, another hiker brushes against a fern. A tiny, poppy seed-sized passenger climbs aboard, ready to begin the cycle anew.